Welcome back to Medical Coding with Blue. Today's episode is all about medical coding, what reading medical documentation is like. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so I'm just going to read this message that inspired today's episode and then we're going to get into it. So here we go. So the viewer says, do you think this can still be a good career field for someone who gets anxious with seeing things like inner body diagrams, but is strong at remembering medical terms and anatomy and physiology concepts? Would this hinder my learning or test taking? I'm not sure if you've already touched on this, but I've watched your videos for a while and might not have gotten to it yet. So here's the thing. You're going to see diagrams when you're studying anatomy. You're going to see, like, when I hear diagrams, I think of, like, you know how they have the abdomen. And even if you open up your CPT book and you see the picture of the abdomen in the back and the anatomy plates, and then it'll show you the quadrants, the different quadrants, right? And it's telling you, like, what areas does that cover, things like that. So if you're looking at that, that's making you anxious, according to this person. So these are not things to be getting anxious about. And I don't know if this is just somebody that doesn't know the words to express what they're thinking. Because yes, learning medical billing and coding is a lot. You will see diagrams when you are learning the material. You know going in that you are going to be reading about medical things, about every single body system, about the disease processes and different stages of disease processes. You know that going in. The thing about medical coders that makes us so different from nurses and medical assistants and all these hands-on technicians is we don't lay hands on the patient at all. We don't touch them. We're not in the operating room where we have to see these things, an actual person, right? So you're not having to see things that are medical. You're not having to smell things that are medical. You are just reading them. It shouldn't make you anxious to read it. And to be honest, if it makes you so anxious that you actually have to ask me that question, this probably isn't the field for you. And I will be very honest when I say that there's a lot of people that maybe shouldn't be pursuing this career field to begin with, not to discourage you, only because if you let something like this small get to you, and this is small, in the grand scheme of things, it is small. Everybody has their thing. I get that, right? There's people that have different phobias, for example, like some people have irrational phobia of like spiders, right? Who likes spiders? I don't. There's a lot of things I don't like either. Snakes. But that being said, it's not going to stop me from reading somebody's record and having to code. Say, for example, somebody got bit by a snake. I would have to code that. Would I get anxious because I'm reading about something that a reptile that I don't like? No. I would be like, oh my gosh, I got to look up this code. That's what I have to do because that's my job as a coder. When you are a coder and you're reading these medical documents, you're reading everything. You will see everything. You will see some medical documentation that is excellently written. I have worked with some fantastic documenters in my time, and they write very detailed. It's to the point that it is poetry to me when I see it because it's so well written. They describe the patient, they describe their condition, and sometimes they talk about the other external factors that are affecting that patient's care, right? You might see an elderly patient and they may write down some things about their home life that may be difficult to repeat, but you're having to read this because it's your job to read it. It's your job to read the documentation and to select all of the codes that apply to this situation. And that includes social determinants of health. And you will read about all walks of life of people, people who come from money, people who are homeless or without a home. However y'all say it now, because everybody says it differently, right? And there's different things. You will read about domestics, okay? And I don't have to say any more things than that. You will read things that will break your heart. You will read things that will be interesting, and you will read things that will make you laugh. There are some things that are just funny because of the way that the provider documents it. And it's not involving anything serious, but it is involving them describing something, right? I had one provider who was describing hoofed stock, which I thought was funny because the way that they wrote it, because it was pretty good how they wrote it. But there's all those things that you will read. And it's not on you to put yourself into it so much that you get so anxious about reading anything, because you're on productivity standards as well. So you do have to get through these records. You have to be able to read. You have to be able to comprehend. You have to be able to make executive decisions of what diagnosis are going to go on here, how to pick this up, and the sequencing and everything. When I say executive decision, because sometimes we can't really figure out how to sequence these. Sometimes you have to kind of question yourself too, you know. And even if the documentation and the codes are already selected, we still need to make sure that those codes are correct. So there's a lot of things that we do in this time as coders in our 8-hour days. For some of you, it's 10-hour days. And there's a lot of things that we do, but slowing down to say, I feel anxious looking at a diagram, is this going to affect me? If it is so bad that you're asking me this type of question, I don't think that you should pursue this, because it's going to get talked about. Body areas are talked about. People and their own personal things are talked about. Psychology notes, everything that patient is talking about in that session is in those notes too. So again, there's a lot of things that you will read. And like I said, some things are going to be like, oh my gosh, this is very difficult to read. But it's part of the industry. It's part of what we do as coders. It is your job as the medical coder to ensure that you are making sure that all of the diagnosis, all of the procedures, and anything else that is pertinent and anything that needs to be clarified is done for this patient. That is your job to do that. It's not about how you feel and how you feel anxious about seeing a picture or a diagram in the record. It's not about that, because you are not the patient. You are not the provider who is working hard to get this patient taken care of. The last thing they need to do is have somebody there that cannot function because they get anxious about seeing a diagram in a record. I had one of my surgeons who was new to me. He actually was seeing a patient in the post-op, and he took a picture of the patient's wound, right, for their post-surgical area, right? It's not a wound, it would just be the area where they have the sutures and stuff like that. He just took a picture of it and put that in the record. Okay, where's the documentation? So I went in and asked him, where's the documentation? That is the documentation. They're in the post-op, and that's what their wound looks like. And I said, sir, no. There needs to be, it's okay to have a picture if you want to add the picture, but you need to have the documentation in there, because I cannot just assume what I'm looking at. You see the wound looks okay, Blue. I can see that there is no redness, but I'm not a physician to say that this isn't infected. This is okay. I'm not a physician. I'm a medical coder. What surgery was this? Was this a surgery for a sprain, a tear, a laceration? You know what I mean? Like, what is this surgery for? Was this a fracture repair? Was this an internal hardware removal? What was this? I cannot just assume. If this was related to an injury, I need to know what injury it was so that I could pick up the appropriate injury code. If this was for an organic condition, like maybe you went in and did a scope for this patient and you were just looking around in their knee and you only saw that they have osteoarthritis in their knee, for example. Well, I know that that's going to be the Z code for the aftercare. But how do I know that if you don't document? So you can't just take a picture? You can't just accept a picture? No. But I signed it. I understand you signed it, but I need to know, what is this related to? How far into the surgery is the patient? I mean, into the post-op is this patient? Everything needs to be documented. I need to see the documentation. I cannot just take a picture, and accept a picture and draw all these codes out from it, because I don't even know what the surgery was for. And so he said, oh, okay. And so he went back to doing that. But could you imagine if I was a coder that just got anxious about seeing a picture? That's where that doesn't work. And it would be wrong of me to say, oh yes, if it's okay. You can get anxious about it. What is there to be anxious about? It's a picture. It's a diagram. There's nothing to be anxious for. This is serious business, guys. This is not something that's a joke. Health information is not a joke. Medical coding is not a joke. Every single one of us coders has a responsibility to make sure that we are coding accurately, appropriately, and that we leave our own personal biases, our own personal fears at the door so that we can do our work. Everybody has something going on personally. Everybody does. Could you imagine if I just let all of that get to me every single time? I'm there working with the chart. I'm there working with the record. I'm there reading a patient's note. I would be no good to that patient, and I would definitely be no good to that doctor. So while reading records, you may run across these things that are hard to read. You may find things that are good and make you feel good. And you will see patients all the way through their care sometimes, from the time that they get admitted to the time that they get discharged. When I was working at my second job as a coder, I was working for inpatient professional service, or pro-fee, right? I was doing pro-fee coding. So I was seeing a lot. And at the hospital where I worked, I was reading about lots of elderly patients. We had a very large elderly population where I worked. And some of these patients did not make it, and some of them did make it. And so you say, hey, that was really good. They were able to heal. And then you will read about how some of them get sick while they are there in the hospital. And then you'll read about how some get well while they're in the hospital. Or they discover that they have another condition. So again, these are all things that, yes, while it may get a little draining, this is part of your job. But you are doing the best thing that you can do without having to lay hands on that patient, because that's not what we do. We don't lay hands on the patient. We work with what we have in that documentation. We ensure that all of those appropriate procedures and appropriate diagnoses are selected, and we move on to the next record. That's what we do as coders. So it's not anything to be anxious about, as I said. And as human beings, we need to toughen up. If no one's told you that and everything scares you, I would personally like to say that we need to really think about, why do we get so anxious? Is it because we have nothing else to do that we think that we are going to be anxious about everything? There's nervousness about, oh my gosh, am I going to get the right codes? Am I going to get this correct? Am I going to do this right? Absolutely. That is normal. That is absolutely normal. But it shouldn't get to the point where you're having to sit here and question your ability to do things. Because if it is making you question yourself right now, you should really and truly pick a different field to get into. And you can think that I'm being mean all day long, but if you just heard my message and it spoke to you, and you say, you know what, Blue, you're right, then I just saved you from having to pursue something that you're not going to enjoy. And it's okay if you start in this and you're just like, oh my gosh, I'm in the school, and it's okay to feel like, what did I just get myself into? But what's not okay is just quitting automatically because you feel a little bit of adversity, or you feel a little bit of anxiety, or you feel a little bit of nervousness that, can you do this? Because you're going to be running from everything all the time. People need to learn to see things through. And this is something that is going out of vogue, I guess, because people just give up on things quickly. Because it's always on to the next thing. This is why I tell people to stay off TikTok, because it's little 10-second, 15-second clips, and you're not getting that time for your brain to sit there and go through all of these things. This is relevant to reading medical documentation. It is. Before you say, well, I thought this was about reading medical document. It is. Because we have to have the patience to sit through some of these notes. Some of these notes will be very comprehensive, and some will have lots of documentation in it that is copy forwarded. So you got to be careful with that, because not everything that you read can be picked up if it's not cited properly, if they're doing copy forward, which I always tell my providers, this is not a good practice to get into, because copy forwarding can bring in documentation that is irrelevant to that particular encounter on that day for that patient. So there's that too. So like I said, if you have a quick attention span, you're going to struggle with these documents, reading these documents sometimes. Because like I said, some of them get very comprehensive. Some are very direct and to the point. I had a provider who did very well with just documenting straight to the point. And his documentation was very short, but it was right to the point. And it had everything it needed. So I was like, well, okay. Because some are better than others when it comes to that. Okay? So that's just what you have to know. You have to be ready for anything and everything. And sometimes you will be surprised when you see pictures in there, in the documentation. But you're not always going to see pictures in the documentation. Most of the time, you're just going to be reading. You will learn what templates look like. And these templates, they have different areas where the information is stored, right? And so you will learn that over time. But if you're in school right now, or if you're doing your research and you're wanting to learn, this is not the time for you to be thinking about, future stuff. You need to get into it now. You just need to start learning it now, if that's really what you want to do. If, like, you're this person right here that says, I truly want this career. If you truly want this career, you're not going to waste your time worrying about little things like that. And it is little. Because I don't understand how anybody can get so anxious over a diagram. And you may get upset with my response. That's fine. It doesn't matter. Doesn't matter. Because again, I really think that people are putting too much time on things that are just irrelevant. And that's their excuse for not moving forward with something. and always kind of spinning their wheels because they're fearful about this or they're fearful about that. Why do you have to be fearful at all? You will enjoy some of the things that you read, right? And some of it will get very redundant. And some of it will get like, okay, I've seen this. And then sometimes you may be reading something and you'll spot a diagnosis in there that needs to be picked up. And you're like, ooh, I've never had to pick that one up before. Or that was a good one. Or that's a good catch. And that's how you start developing and refining your capabilities as a coder. So that's just what you have to know, okay? That's just my advice anyway, because like I said, some of these comments, I'm just like, I don't understand how anybody can get anxious about stuff like that, but yet you know you're going to go into the medical field. It's not like where they go through medical school and they have to be around certain things and they get really nervous and like their body just reacts every single time. We are readers and we're reading. There's nothing to be afraid of. There's nothing to be anxious about. It is on paper. The only thing that you should be nervous about is like, oh my gosh, did I get this? You know, am I going through this? But if you are reading the coding guidelines, taking part in that coder guidelines challenge I got going in the month of October, starting October 1, where you're reading the coding guidelines in their entirety 4 times in the month of October, so that way you can get a good foundation. You don't have to memorize, but you do have to have a good grasp of the guidelines. And you'll always have your guidelines with you. You even have your books with you when you're taking the exam. So you don't have to memorize, but you do need to kind of have an idea of like, oh yes, I know what chapter to go to when I need to look up this scenario, or when I need to look up mother-baby, or when I need to look up sepsis, or when I need to look up about injury codes. That's what you need to do. That's what you need to focus on. Not this other stuff here, because that's irrelevant. And again, if it bothers you that bad, then there's other career fields that you can pursue. You don't have to pursue this one. But think about that. Consider all of your reasons for wanting to go into this. And if this is something that you want so bad, then you will pursue it. And you will not allow diagrams to make you feel so anxious that you have to ask this kind of question. Okay? I'm just saying. And like I said, for those of you that get very sensitive about my directness, my particular brand of vodka may not be yours, okay? It may not be. But that's okay, because that's what makes the world go round. If we were all the same, we'd all be bored, okay? But like I said, I am very direct so that people get the message. Because sometimes you have to kind of sprinkle a little bit of spice on your response so that people can get their attention. Because if you don't, then you get kind of questions like this. Where did this kind of question come from, right? I'm just saying, I don't know. I don't know anymore, guys. Really and truly, I don't know. But like I said, reading this medical documents is a lot of fun. You will learn things that you did not know. And sometimes when you see the provider's level of detail in their documentation, that's very interesting too. I had one surgeon that I've worked with in the past who, fantastic, but he wasn't always like that. He took work to get better, but he wanted to get better. He wanted to do that, and he did. And it's a good thing, because these records and the way that they're written are going to be viewed by other doctors, other surgeons, other specialists, attorneys, if there's a case, and even the patient's family or the patient themselves. They can see what the doctor wrote. They have a right to their documentation and to see their records. And if they see something that is incorrect in there, maybe an incorrect diagnosis or whatever, they can always ask for a correction. That is why. they're allowed to see their documents. And what is documented about them will affect them. It will affect their care. So, but again, it's not anything to be scared of, because we don't lay hands on the patient. We don't see this stuff in person other than in a picture. I'm just saying. So with that said, I'm going to go ahead and wrap this one up. But it's nothing to be scared of. This is just an adventure. It's a new adventure, ready and waiting to happen if you let it. With that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share. And I'll see you all next time. Bye.